Many mothers, after they see their pregnancy scan reports, have a question about what an anterior placenta is. Does it have any, does it cause any problems or any health issues for the pregnancy? So in this video, let us discuss all about anterior placentas. What does it mean? And then does it have any complications, etc. Hi, I'm Saranya, the founder of Babypedia. I'm a pregnancy coach and a life coach for mothers. So now first let us look at what is a placenta and then we will talk about what is an anterior placenta. So the placenta is essentially an organ that gets formed during pregnancy. So once the fertilization of the egg and the sperm takes place, the fertilized baby, the embryo, will travel towards the uterus from the fallopian tube. And then when it reaches the uterus, it will usually split into two different parts. I mean, it's connected, but then some of the cells will split and form an organ called the placenta. And this will attach onto the wall of the uterus. And then this placenta is connected to the baby through the umbilical cord, and then the baby is getting formed and developed. So now which part of the uterus this placenta attaches to will determine the position of the placenta. So this can be anterior, posterior, fundal, low-lying. There are different terms, but in this video, let us look at what an anterior placenta is. So an anterior placenta is when the placenta gets attached to the front, that is towards the stomach part of the uterus. So when the mother is pregnant, if the placenta gets attached towards her stomach area, then that is called an anterior placenta. So usually this is pretty normal. There are no complications unless your doctor has given it as a low-lying placenta. So when you have an anterior placenta, there could be some things that change compared to a posterior placenta. For example, because the placenta is cushioning the front, the stomach part, baby's kicks may be felt later because baby is kicking the placenta, so you may not feel it early. So some mothers usually say they start to feel the baby's kicks at around 22 to 24 weeks of pregnancy instead of at 18 or 20 weeks. So if you have an anterior placenta, you can expect to feel your baby's kicks a little more later. So please don't panic and do not worry. Another thing that could happen, I'm only saying could happen, it increases your chances, is positioning of the baby. So during delivery time, there is a higher chance that your baby could be in the posterior position, that is your baby's spine is towards your spine. So this can lead to something called back labor, where the mother is experiencing a lot of pain in her spine and her lower back during labor. Okay, there's more pain and discomfort on her lower back. So this is called back labor. So in case you're having an anterior placenta and you experience a lot of discomfort in your back during labor, then please check out what are the steps you need to do to manage back labor. For example, different positions. You can hold positions where you are leaning forward so that it encourages your baby to move forward instead of putting pressure on your spine. You could do back massages like counter pressure. Ask your birth partner to do counter pressure, and you could, this will also give you a lot of relief. Warm compress will give you relief from back labor. So these are all different tricks that you can already learn before you go into labor to be prepared to handle back labor. But other than this, usually there is no big difference or no major health complications that are specific to anterior placenta. The normal complications that can arise for any pregnant mother may be there for you, but other than that, please don't worry if you see the words anterior placenta in your scan reports. Take care. I hope you learned something new in this video and it gave you a lot of relief with your doubts. If you liked it, don't forget to hit the like button. Subscribe to the Babypedia channel to get more updates about pregnancy, birth and taking care of your newborn baby. I will see you soon in another interesting video. Till then, this is Saranya signing off. Take care.